Well, amid a family doctor shortage in this province, the Ontario Medical Association says it's seeing a rise in the number of people trying to diagnose and treat themselves.
Okay, the OMA says more people are turning to AI, looking on social media or elsewhere online to try and diagnose a possible condition. The association says that when patients diagnose themselves or undergo DIY treatment, they may not actually fix the problem and could cause unnecessary harm.
Sometimes some of these things are very general and they're not actually speaking to what you're specifically worried about. So you might be getting some suggestions that are not appropriate. There's a risk that you could also be taking on interventions that may be harmful to you because they're not necessary and they're actually causing other new issues. Or you could also have this delay where, there's a lot of different issues that when they do come up, this would also be very helpful to have taken care of early.
A 2025 survey from the Canadian Medical Association found that 23% of Canadians said they have had a negative health reaction after following advice they found online. So for a closer look at this ongoing trend, we turn tonight to Dr. Raghu Venugopal, emergency physician at University Health Network. Good to see you, Doc, and thanks so much for joining us.
Thank you for having me.
So I'm sure you hear this all the time, people saying, hey, doc, I already know what I have. I Googled it. I turned to social media. What do you tell those patients, and when might that work in their favor?
Lena, as a busy emergency room doctor, I always applaud and am thankful for patients who are engaging in their health. I personally am very comfortable if patients want to Google or AI their symptoms to raise suspicion or to investigate why they may be feeling that way. But the important caveat is that they bring it to the attention of a trained medical professional, whether it's their family doctor, a nurse practitioner, an ER doctor, or their specialist. The main reason is, Lena, is that sometimes patients are right. I have had patients who have come to me and say, I'm having a retinal detachment. I'm having a heart attack. And they are right.
Wow.
But most often, they are not exactly right or very wrong. And undertaking a treatment without medical evidence could be, as the OMA president correctly said, very harmful to their health.
And, when it comes to DIY, look, last summer we had this conversation. There were so many people looking on the internet doing a DIY sunscreen instead of actually going to the store and getting the real thing. So let's talk about what's going on here. Why are more people saying, hey, I can do this on social media? This person says that. And what really happens?
Bakar, you raise an incredibly important situation, which is the use of sunscreen and the risk of skin cancer. I have taken care of many, many patients with melanoma. And melanoma is a very aggressive form of skin cancer that happens to younger patients that is preventable. And so for people who take care of melanoma, we know the value of sunscreen. And to get to the heart of the question you're asking, it's because of financial incentive. When you see Ontario doctors, when you see me in the ER, I receive no compensation, whether I prescribe or don't prescribe, because that's just not part of our healthcare system. What I encourage listeners is to be very careful when there's a financial gain by the person giving that advice, or if they're simply not a trained professional. Bakari, I have prescribed ivermectin in Central Africa for people with filariasis and elephantiasis. I have taken care of people who have ingested bleach, for example, and they go to the ICU with an artificial tube in their lungs. And so there's a lot of bad advice out there, whether it's ivermectin, sunscreen, bleach, the list goes on and on. The most important thing is use the internet carefully. AI and the internet is a wonderful tool for people to investigate their symptoms, to connect the dots, to bring forward to a qualified professional, that being the most imperative thing. Because frankly, as an ER doctor, I am very prepared to engage with my patients on what they've researched, what they fear the most, what they want investigated, and we can have a discussion about how to engage. But really, we need them to bring those concerns to a qualified professional with no vested financial interest.
And really, really quickly, Doc, if I can just get your thoughts on the fact that the OMA says part of the reason why this is happening is because not enough people in our province have a family doctor. I wonder if you see that in your ER, people saying, look, I just Googled it because I didn't have anybody to ask.
We see a lot of people coming to the ER with minor problems who do wait a long time. But I need to be absolutely crystal clear that the problem in Ontario healthcare is really not those people with minor ailments who want to come to the ER to get checked out. It's more that we can't get seriously ill patients up to the bed that they need upstairs. And so really, I think if people are in doubt, talk to a doctor, talk to a nurse practitioner, talk to a family doctor, go to a walk-in clinic. And I would say I do applaud the Ontario Ford government that is legitimately trying its best to increase the number of family doctors. Do we have enough? No. Our efforts ongoing. I applaud Deputy Premier Jones and Dr. Jane Philpott, who are working very hard. And I'm hopeful we will see more family practitioners coming down the line.
Dr. Venugopal, emergency physician at University Health Network. Thank you for your time this evening.
Yeah, thanks so much for the conversation.